Fantastic. Tov. Good morning.
Good morning.
It's so nice to be with you, Professor Braverman.
Thank you for inviting me.
Oh, it is totally my pleasure, and I've been waiting for it since we made the decision to meet. I was so delighted that you have such a hectic, schedule, and squeezing us in was really a wonderful present for me. So thank you so much for your generosity with your time and with your knowledge beforehand. Hello to everybody. This is Yali Admati from Building the Future the Israeli Way. Just to remind us that this is, we want to join, we want you to escort us in having a view about what is really happening in Israel behind the scene, behind what you see in the news. And there is another face to Israel that I think you would love to know, share, and accommodate. So this is what we do here in Israel, and how we use innovation for the greater good of the human society. So today I have the great privilege and honor to meet with Professor Braverman, which I met through some, I would say, family issues. And just to give you a little bit, and it's only a hint of his achievement, just to let you know. So he is the head of ENG head, which is head, neck, and surgery, and co-director of the National ENG Muscular Dystrophy and Neurologic service in the Hillel Yafa Medical Center in Israel. I'm sorry if I made a spelling mistake.
It's okay. I will elaborate.
Wonderful. He is also a clinical associate professor in the Rappaport Faculty of Medicine in the Technion, which, as you know, is a wonderful organization. He did his residency in the Hebrew University in Jerusalem, in the Faculty of Medicine in Hadassah University Hospital in Jerusalem. Also, he was a fellow, a clinical research fellow in the Jewish General Hospital in McGill University in Montreal, Canada. And he has published numerous journal articles, and he's also highly involved in the high-tech scenes, which is really a collaboration between medical people and people who are coming from deep tech, in order to enhance our ability to take care of our people, meaning also the sick ones, but also the patients, but also the one that might become a patient, and how can we prevent any kind of problem to become, a serious, or I would say ongoing problem that deteriorate their lives, quality. Am I right about
Yeah, you're absolutely right.
Brilliant. Can you tell us a little bit about yourself before we go into, all the beautiful things that you've been doing? Can you tell us a little bit about your history and how you got to what you're doing? Yeah.
So I'll just tell that I'm married and I have 4 children and 1 granddaughter.
Oh.
And I was born in Jerusalem, 4th generation in Jerusalem.
Wow.
And I went to the army, and then I became an officer of communication, electronic and communication in the artillery. So technical things came just from the army, 4 years in the army. Then I went to the Technion to learn medicine.
Did you know you wanted to become a medical professional from before that?
I knew that I want to be a medical doctor already in my bar mitzvah.
Wow!
So I did, if I may, I learned biology in Jerusalem in the high school, and mathematics, and I did some things in Magen David Adom in Jerusalem, like volunteering and some research in gastroenterology in Shaarei Tzedek as a high school.
Wow!
I knew that I want to be a doctor, and all my task was to get the facilities. This was the target.
Why this burning passion to become a doctor?
I don't know why. I don't know to say why, but to go on an ambulance and to go to patients that have heart attack as a volunteer and have the action to do this and help people, I can tell a very small story
Yes, of course.
that just came to
Yes.
my mind just now. When I was like in the beginning of the high school, like it's like Kita Het, like
14 years old.
14, yeah, something like this. A new immigrant from Argentina came to our class. His name was David, and he was going with the help. It didn't go well.
He had crutches.
And then slowly, he deteriorated.
Oh my God.
He had a neurological illness that that we know that it's progressive. With at the end they die in like the age of 20 or 30.
Wow.
And nivun shririm it calls, Duchenne or something like this. And when I was a child, I didn't know, but I automatically went to be his friend. Then he was in a wheelchair.
Oh my God.
And the good thing is that his parents was the owners of the Holy Land Hotel in Jerusalem. That they have the house there, and there was no problem that he has a private driver, but he needs someone that he will go with him every day in the beginning, and he take his things from the bag, and
like
manually. And at the end of the high school, he finished the high school on a wheelchair, very weak and
fragile.
I would say with nivun.
Yeah. There was a total deterioration. Yeah.
And then we went to the army, and he was at home. He went to the university, did BA in the university, and then he had a tracheostomy. The breathing was not good, and at last he died. But I was with the family till the last day.
Wow.
And it's a very sad story, but this is thing that maybe it was in my bones when I was a child. Bring me to be a doctor.
Wow. This is a beautiful story.
This is a story. It's not connected to what I want to do. It just came out.
No, but I think it's beautiful because it gives the context, meaning that from you had the compassion and the willingness to assist people, and you saw them, and more for me what was touching is that the fact that you saw the person behind the sickness.
Yeah, and when he was like, as he went to and deteriorated more and more, the children went from him. He didn't take close to him. They had some distance. Yeah. They were afraid. But I was stuck to him because I don't know why.
That's a beautiful story.
Yeah.
That's a beautiful story.
And then I proceed, then I went to the Technion to do the medical studies. It was very difficult. On the second year, there was the war in the Lebanon war.
Yeah. One of the wars,
and I was already a doctor medical doctor in the unit that I was in. It was יחידה מטכ"לית של תותחנים. It was artillery, very high, something important, and we were in Lebanon, and I was the doctor there. And then I had a problem that the Technion wanted me to do the exam, in the mathematical exam, and it was very. I couldn't be. I was in Lebanon, and they didn't let us. Free with this, and we had to get a summer semester, and we learned to finish the mathematics, and then we did. And my friend that did with me the mathematics and did the second time because of the war is the chief of the Hadassah Medical Center.
Wow.
The head of the So it was started like this.
Wow. Meaning this is how you become a doctor in Israel. Yeah. There is a war, you have to go to war, but still you have to finish your studying. Yeah. We don't care that.
No reduction. No. You need to do everything.
No pass. You're not getting a free pass for anything.
Then I went to Hadassah Medical. I wanted ENT. I wanted otolaryngology. It's a unique subject because you treat everyone, children, old ones, people, everyone, and it's also surgery and also medicine, and you can do everything with this specialty, and ENT or otolaryngology. It's very hard to get because a lot of people want to get it.
Why?
It's very demanded. In plastic, eye surgery, skin, dermatology, ENT, and this was my target, and I was accepted in Beersheba, and in Haifa, and in Hadassah. And I preferred Hadassah, it's very good. And it was a program of 5 years, now it's 6 years. And I did the program, and it was very hard work. I had 2 children there, and afterwards, all the time. Then we had another 2, but it was very good. I finished the residency in Hadassah. Then I went to fellowship in Montreal.
How come? How come you suddenly from Jerusalem to Montreal? How did it work?
Because when you finish the medicine and the residency, you get a diploma of ENT, of otolaryngology. So it's general otolaryngology. In otolaryngology, there are a lot of subspecialties. There is head and neck, there is pediatrics, there is otology, there is rhinology, there is laryngology. So you need to pick one and to be very good in the subspecialty. Then I went to Montreal, to the Jewish General Hospital in Montreal, McGill University. It's very good university. And I did the rhinology there with all the family. It was very good time there. No wars.
At least not in Canada, no wars, yeah.
Yeah, and I had a mentor, very mensch mentor. His name is Saul Frankel. He was the head of all McGill programs for it's 4 hospitals there now.
Wow.
And he is an excellent mentor, and I had a very good teaching there. I did also research there, basic research in the Macon Christie Laboratory.
Wow.
It's a laboratory of lungs,
wow.
of pulmonary, and I study with him the cilia. The cilia is the microscopic movement of the hairs that is on the top of our lining of the sinuses, of the trachea,
wow.
of the
wow.
lungs, of the female organelle tube, of the tube,
yeah.
of the Eustachian tube in the ear, and
wow.
and the tube in the genitalia of the female.
Wow.
And sometimes there is problem with the cilia,
wow.
and there are sometimes infertility, or sometimes problem with the ears, and sometimes sinusitis. And this is the basic thing that needs to be good and to work good.
Wow, I didn't know that.
So
wonderful.
I did a research there on
wow.
this, and then I came back, and I got the position very young. I was 40 years old, and I got to be the head of the department of the otolaryngology head and neck in Hillel Yaffe Medical Center in Hadera.
And you're still there, Tim?
And I'm still there.
Wow, wonderful.
22 years.
Wow. They're very lucky.
It was very small department, very small unit, and we made it a big one with 7 residents and
wow.
All the facilities, and it's nice.
How many people are you taking care with your team at this
Our region in Hadera is it's almost 1 million people.
Wow.
With the area of the Arab area that we are taking care of them, and we have 30% or 40% people from them, and we also get from Tel Aviv and from Beersheba and from the north, because we are doing special things that are not being done in another places.
Wonderful.
And
wonderful.
we will talk about it.
Yeah, we'll talk about it later. Wonderful. So, first of all, it seems that you're very happy with your life, even though I know that you hardly sleep and you're mostly working all day long. Am I right?
Yeah, I sleep very little because I'm busy, but I like my work.
That's what I'm saying. I say you're very happy with your life, even though you don't sleep so well. That's
Yeah,
what and you don't know you sleep well, but not much.
Yeah.
So I wanna know from your perspective, because as you said, you also have some background in mechanical and technology and a technical point of view, but also you're deep into the medical field. What for you is innovation? What does it mean for you, innovation in general, and in relationship with the medical field?
Okay, so innovation is something new that is not there in our end, and we need it. So how it comes when we doing things with patients, and we think we are doing like a thing that is done 100 years, the same thing.
The tradition.
We do the things like this, and everyone doing the same thing, and this is what we learned, and this is the way, the normal way. So there are people that go to work, come to home, go to work, come home. But there are people that wants to change because they think that it can be done better in another way. So if we think we can invent something that will help the patients without the regular way to get out of the box and think differently, this is innovation. And innovation needs to be a brilliant idea out of the box that it can be done, actually done, and we can made it to help the patients to feel better.
Okay. What you mean is that you have to, in a sense, leave behind the old methods and be brave and sometimes
like
bold.
I will in our field, exactly. In the past, when we want to go to the sinus, the maxillary sinus, it was with the very old-fashioned from 82, I think. It's called Caldwell-Look operation.
Okay.
There is like you built in a stone, like the architect or the sculpture built in the stone with the hammer and the chisel. We open a window above the teeth. It's called a window to the maxillary sinus. We make a hole and we clean. This was done many years. Then there was the invention of the endoscope. When it was invented, it changed the medicine. So we can go through the nose and through the natural ostium of the sinus and open the natural ostium. And we learned that this is the physiological way. And the cilia bring the mucus from the sinus to the natural ostium. It doesn't bring it to the open, the opening that we did with the chisel. And all the concept of operation of sinus has changed with the invention of the endoscope. And Messerklinger and Stamberger from Austria brought this idea to the world. It was, I think, 30 years ago, something like this.
It's very new then.
And Professor David Kennedy afterwards brought, he was a young ENT from Philadelphia, and he brought it to the United States.
Yeah.
And it spread in the United States, and this is the way that we do it till now. And and then there are new things on top of this, and I will let you know more. But this is innovation.
Okay, wonderful.
And there are more and more innovations, and now we see so many things that are good for the people, for doing minimal invasive surgery, and for doing things that you don't need to be hospitalized like for 3 days for one operation. You can go, do the operation and go.
Yes, as you did, if I may say, with the patient that we both know, you did 3 operations. I mean, in one
Yeah.
day, and you finished in few hours. Yes, so
Yeah.
this was remarkable. Yes, so that's beautiful. So I know that you divide your time between taking care of patients and besides trying to solve big medical problems with the assistance from people from the high tech. Am I correct? This is how do you divide your week?
The time is in the hospital. I'm running a department, and it's full time. It's a full time in the hospital. Afterwards, in the afternoon, I have some clinics that I see patients, and once a week, I have a surgery day for like private patients and special operations outside of the hospital. And out of this, I have connections with startups and things that I think that are very important to do innovation. Part of the innovation I bring to the hospital through the research. So if we like taking a concept of thing that we need to do a proof of concept to a thing for or topic, we bring it to the research department. We make a program. We get an Helsinki agreement that we can do it, and then we run a study with clinical trial with the residents. It may take 2-3 years or something like this, and we have many clinical trials also from big companies that want to do studies in our department, because we are doing the studies very precisely and very correctly for like from medicine, like biological treatment and other treatment, and also medical devices.
Interesting. So what you're saying is like a positive cycle that, you know, and you're doing something in the research, then it goes to any kind of innovation, or the other way around.
Yeah.
So it's like feeding itself. The different parts of your, I mean, the organizations that you're, you know, a part of, are connected with, are usually in the same, in the end, feed themselves into a much positive, I would say, outcome.
Yeah.
Okay. And may I ask, in how many startups have you been involved until now?
Okay, so it's all started.
Yes, please
from
tell
the
us the story.
Celia, actually.
Okay, wonderful.
It's all started from the Celia, and when I did the research on the cilia, I saw that we can measure the ciliary beat frequency. We can see how many hertz the cilia move.
Wow!
And if it's slow, there are some illness, and if it's high, maybe the body wants to do something to clean the mucus.
Wow!
And it's very interesting.
So what you're saying, even if people don't feel that they are sick, if you check this, only this measure, this give you an idea whether there is something is going to happen.
Yeah.
Wow!
Yeah,
it's like pre-maintenance or prediction.
It's a basic thing that if it's not working, the patient will feel very ill.
Wow!
Like cystic fibrosis.
Yeah.
Children with cystic fibrosis that the cilia doesn't work good. They have a problem with the lungs. They cough all the time. They don't hear well. They have fluid in the ears, and they are very sick.
Wow!
The cilia must go on and be good.
Okay.
So I had an idea.
Yeah.
When
now, was it?
It was, I think, 10 years ago, something like this. I don't remember exactly.
That doesn't matter.
And when you want to check cilia, you need to take a biopsy, take it to the microscopes, take an electron microscope, and do. It's not easy. It's
a complicated process.
Yeah, and not every hospital have the facilities like this. And I had an idea to do. To make a device that will check cilia in vivo. What is in vivo? In the clinic. So I put like a pistol in the nose, put some device and it will tell me what is the situation of the cilia.
Wow.
There is nothing like this.
Wow, it's amazing. Like you're in the body, even though you're looking inside the body, even though you're totally outside of the body.
Yeah.
Wow.
And I got I had someone that helped me with this.
A grant for that?
It was not so a grant. It was my money.
You helped yourself.
I helped myself, and the guy that helped me, he was from the optical engineering. He was a physicist. He had a very high knowledge in lasers and physics and nuclear medicine.
Wow.
And we wrote a patent on this, and the thing was that you put a laser, you put a nano diamonds that are splashing
Wow.
on the cilia,
Yeah.
on the surface, and you put a laser that illuminate them.
Wow.
And then you read the light from the diamonds in another laser, and it will calculate the velocity.
Wow. Wow.
It was like a thing
it's
that
physics and medical.
and we
medicine
built
together.
we built something like this,
Yeah.
and we had a patent and this, but the problem was that that I didn't know that when I have an invention, I went to the head of the hospital, the chief general of the hospital. I told him I have an innovation. So he said me, "You are a very nice guy, but it's not yours. You invent something, but it's belong to the government, you know."
Really?
Really,
Why?
I didn't know. I was very naive. So if you invent and if you are a full timer in hospital and you have an IP,
Yeah.
most of the IP belongs to the state.
Wow. Okay.
And the guy that I was with him didn't know it and they didn't like it, and then was but we solved this thing. But the other thing was that the patent was not so strong, and we couldn't
Defend it.
defend it. So we abandoned.
That's all.
Fine.
וזה בעצם שאי אפשר להגן על...
So the patent was not strong, and we had to abandon our patent, and this can happen, even if the idea is very brilliant, and you cannot protect it. It will die. But the thing that was good from this, first I learned how to work with the environment of the hospital and all the
regulation.
This is the word, regulation. And I met a guy named Avinoam, and he was the CEO of this project, and he understand that we abandoned this project, but I told him, I don't abandon you, and we will have another thing. And then we figured out what we need to be, what is missing in our field. And Avinoam, with some thinking, had another idea of a device, and now it's a company that's called Sinusafe.
Sinusafe. And what's
Actually, I'm the medical advisor, and I'm not the IP. I'm not the patent guy, but I am helping him in the medical thing, how to make better the patients. What is the device? The device is a very clever device that goes through the nose endoscopically, goes to the orifice of the sinus, to the natural ostium of the sinus, go with a very thin cannula to the sinus itself. Then with one hand you pull in a very thin cannula, you can irrigate the sinus. Then you can, if the sinus has a full of pus and polyps or junk, you put in a thin wire, 19 wire, it's 1 millimeter or something like this, and this rotates 5,000 RPM,
Wow.
like a drill, like a nano drill or like a nano debrider, and it will break the mucus, and it will break the polyps, and it will be fluid, very like watery, that can be sucked through the very thin cannula outside.
And this is helping in which situation?
And then you clean the sinus, you wash it, you take everything, you throw the device. It's one.
It's a disposable one. Wow.
Disposable. And through this thing in the future, we want to put also medicines through this device in the sinus without surgery, without breaking everything, on local anesthetic in the clinic, no operation.
Well, and it's to which situation, which medical situation it's going to help?
It will help in acute sinusitis, in chronic sinusitis. We did a research in Hillel Yafe on 10 patients with acute sinusitis, patients that got like 2 weeks antibiotics and was hospitalized with pain, and after treatment with this device, 24 hours they went home and they were cured, and we published it, and it's nice. Now we are going to do another research on chronic patients. We also want to do a study on patients in ICU, in intensive case, in intensive care units that are have prolonged mechanical ventilation, and many patients with the mechanical ventilation that are in the intensive care have sinusitis because they lie down and they have pus in the sinuses, they have fever, and they deteriorate. And if we wash the sinuses with this device, we can shortening the time of the intensive care time.
Wow! You know how much do you think it's going to improve? Like from 6 days to 3 days, or what?
We don't know. We don't know. We want to research. We want to study this. But this is a very clever
solution.
idea,
Yeah. So what you're saying, if I may ask, just to make sure that our audience understand, what you're saying is that you created a device that assists in taking care of this issue, but the implications are very. There are vast opportunities.
Yeah.
From ICU patient and to people that have high resistance, for example, to antibiotics.
Yeah.
So wow, that's wonderful.
And the concept is that we have a platform. And the platform can do many things. We think already to go to the ear and go to the other sinuses, the frontal sinus or other sinuses with the same device, because if we can cure the sinus and put medicine, or in the future maybe to put microbiome in the sinus and cure the sinus, this will be like a far target, but we think far.
Yeah.
I just got the white journal. It's called the Otolaryngology Head and Neck Surgery from just now from the mail, and on the envelope I show Yali a note that there is a type 2 inflammation, maybe a clear connection, and the drawing show that if you think wide on a subject, you can treat the lungs, you can treat the sinuses, you can treat everything when you treat widely.
Wow. And also, if I may say, I heard a talk about longevity, and there was a discussion about inflammation as one of the route to, unfortunately, to deteriorating the body and to the aging process. So it might also assist in longevity.
I think in the future, because when we are dealing also with the microbiome, and there are studies that talk about the microbiome and what you raise now, and it's very beginning, but this is the future, and this is very hot topic, and we are studying it. I don't want to say things that I don't know yet, but it's very interesting, and the thing that is make me passionate to investigate.
Wonderful.
So this is the way.
May I ask just another question? Also, because you said that this is going to be device on one hand to to go in and clean, but also in the future to this is going to be another route to not a small molecule, but perhaps other kind of medicine. You think it can be also used to deal in some way with the brain issues like Alzheimer, Parkinson?
In the brain, there is something that is interesting, because nowadays there are some investigations on bringing medicine through the olfactory way. The olfactory is the nerve number 1. It's the nerve that we can smell with this, and this nerve is in the front of our brain, going through the base of the skull, the anterior base of the skull, in a bone that is like cribriform, with this very small holes, and the nerve of the smell, it's called the olfactory nerve, going in the nose, and we can smell with these fibers.
Wow!
And there are some ideas to make medicine that can go through this channel to the brain.
Wow.
It's very preliminary, but this we need to think about this.
We need to think. Wow. So right now you're really building. On one hand, you're building a platform. This is one.
Yeah.
Okay, but I know you have other.
Yeah, there is another thing. I'm dealing with sleep.
Yeah.
Sleep
Can
medicine.
you tell? Yeah.
Sleep medicine is fascinating because we are treating patients that don't sleep well.
When did you started working on this?
Many years ago.
Okay.
It was because snoring, we know that snoring is like the top of the iceberg, and many children have sleep apnea, and we treat them because of the big tonsils and adenoids, and we treat them, and a lot of patients that are tired and they don't sleep well, they can have a sleep apnea syndrome, and we need to get them free of this. They are it's a big topic. We can maybe talk about this in a different hour.
Okay, we
will.
We will.
One of the things that is the diagnosis of sleep apnea, and now we diagnose sleep apnea by the history of the patient. The patients come and say, "Look, I'm snoring. I don't sleep well. I go to sleep in another room because my partner I'm disturbing my partner, and I don't remember things." And we see in the sleep laboratory that he has sleep apnea, but it's not enough. We think there are another tools that we can see and diagnose the problem. And one of the things that I'm thinking on is the look of the face.
Really?
Yeah.
Meaning you can look at me and know.
Look if you are tired or not tired, and maybe with computer learning, machine learning,
okay, with
we can learn more about the face and see what patient has sleep apnea and what patient is with no problem. And there is a company that wanted me to be involved, and I start to be the like a medical assistant, to take the knowledge, the technical knowledge of reading the face with mathematics and physics, like face image, face recognition. It's not really a recognition, but it takes parameter of the face, and by mathematical modulation they can read all kinds of things that we cannot know, and they can and they can tell me if this patient is like sleep apnea or other disease maybe, and we can use it for medicine. See,
Wow,
this
that's
is very
wonderful.
starting.
That is
It
on the
is just
beginning.
on the beginning, but I think it's very interesting.
So we will have more time to
I
speak
will
about
I will
sleeping.
be happy to do a research on this and learn, because I think we have something here.
Okay, that's wonderful. Okay, and
We had the other researchers, like
Yes.
I tried to give patients with sinusitis and chronic rhinitis
yeah,
pomegranate.
what is it?
Pomegranate is rimonim.
Oh,
Like it's one of the 7 fruits in the Bible.
yeah, yeah,
Very healthy.
yeah.
The pomegranates. So I took the pomegranates. We make it like a medicine, like a spray. The goodies from the pomegranates, and I did a study, like 4-year study on patients, and double blind, yeah.
Wow.
And we saw that it's very good for chronic rhinitis, and it's not a medicine; it's just food.
It's unbelievable.
It's unbelievable. It's an antioxidant. It's very
Wow.
strong antioxidant, and it's good for the atherosclerosis. It's good for the heart, like wine, like red wine.
Really?
Yeah.
Wow.
Also antioxidant.
Wow, this is brilliant. May I ask? You seems as if you have so many sources of inspiration, and you connect totally different world, meaning medical and AI, agriculture and medicine. How do you come up with this? I mean, this is very creative. How do you come up with these ideas? I mean, this is astonishing, because you're spending, most of your days with patient, and so how come you come to and say, oh, well, I want to use this fruit? I mean, how do you come with these ideas? How do you come up with these ideas? I think it's beautiful. So.
Sometimes when I meet patients, very interesting patients, that you need to, if you meet a patient that is very interesting, you treat him. But if he tell you a story and you get a connection with him, sometimes he's from the kibbutz that raised the pomegranates. The pomegranate idea came from a friend. Like 20 years ago, this friend, he was not my friend. He's a chaklai, agriculture.
He's a farmer.
He farmer that raised pomegranates and other fruits. And he came with his mother, and she has grade 4 carcinoma of the larynx. Like it's a tumor, aggressive tumor of the vocal cord. She was a very high smoker. And I told him, look, if I will not operate her and take her throat out, the vocal cords out, a very big operation that we did yesterday, another one like this, she will die.
Wow.
She had no air.
Wow.
So he says, look, I'm counting on you, do what you need to do. And we did it, and she was free of disease like 25 years or something like this. Then she died with like in a very old age.
Okay.
But from this point, he became my friend, and he told me, look, I'm a farmer. I'm eating pomegranates every day. I take the pomegranates and the children eat, and we don't have tonsillitis when we eat it. So I told you, look, this is a good idea. I will do a research on this.
Wow.
And then I went to the research on the nose.
Wow, this is interesting.
I will let you know on another research that I did.
Yeah.
This was a research with the electronic nose.
What is it?
What it is?
I didn't know a nose is electronic. Yeah.
There is a very brilliant professor in the Technion.
Yeah.
His name is Professor Hussam Haik. Now he was the head of the. He was very high degree in the chemistry engineering in the Technion faculty, and he invented a area of nano sensors that actually the target is to fill the air, to fill the molecules, the molecules in the air that we breathe, and feel what is in the air of the patients.
Wow.
So I will let you know what is the idea, that if a patient will put his air from the lung in a container, and we will take the air and we will examine the air with this computer electronic nose.
Wow.
The computer can identify if the patient has a cancer, a lung cancer, from the breathing.
Wow.
Now they try to do it for corona.
Wow.
And I took their ideas, and I took from patients with chronic sinusitis, nasal polyposis, rhinitis, allergic rhinitis, air and they didn't know, they did not know who is whom, the patients.
Yeah.
And we took the air and we checked it in the Technion in the electronic nose, and the computer told us this has this disease, this is this disease, this is chronic sinusitis. So the computer can tell us from the molecules in the breath what is the disease.
Wow. So it's like another layer of, I would say, reassurance or validation of the prognosis, if I may say.
Yeah, and it can be good for all kinds of diseases.
Yeah, and for the doctors, because it makes you, it's like another expert looking at the information, and you can be assured that you're taking the right path, right? Wow.
It was good, and it was published in a very good journal,
and it's being used now.
They try to do it now practically on corona.
Okay.
I don't know what is now. Look, if someone comes to the airport and just blow air in this device and can see if he has corona, it can save time and money.
Yeah, and lives.
Yeah, and lives.
Wow.
So this is another thing that we need to know, that when we breathe, we have molecules in the air that we breathe. That's brilliant. That you can make diagnosis of diseases from this.
Also, can you also, for example, if someone had a tumor and he was treated, it might be a way to to continue checking whether there whether he's a survivor of cancer.
Yeah.
Is there an existing risk, or is he really can go on with his life, and he can be
you have a baseline, and then you follow up.
You follow up, and then you have a like a weekly checkup, and then you don't even if this might even you probably know about liquid biopsy, so it might even be something which is much easier, less expensive to do for people who already survived.
It's very cheap, because you just need to breathe to a container.
Yeah.
The device there is expensive, but this is preliminary. I think if we work on this, it will.
So are you going to continue working on this?
I hope so.
You hope so.
We now with the corona and things,
everything is safe. Okay, what else? I'm sorry if I'm asking too many questions.
No.
I know you're doing also other things. So can you talk about the other issues that you're totally involved, and that you think that people all over the world? Because I know you're Professor Braverman. I know you, and you're incredibly humble. But may I say that correct me if I'm wrong, that what you're doing is not only for the Israeli population or the Jewish population, or it might have, hopefully it's going to have implication regarding worldwide health, meaning
of
because
course, diseases are not just in Israel, they are everywhere, and we want to make collaboration. Just now, one of my residents told me that people from Nigeria want us to go there and do surgery for people in Africa. So maybe we will go to help them there.
Wow!
And there is more things. All the time things are coming, and it's fascinating, because it's not boring. If you just do the same thing every day, it's boring. When you do new things, life is charming.
What you say, I totally agree. Meaning, for you, innovation is breathing. It's like breathing. You have to do new things. I understand. So no, I just wanted to make sure because I think I think when you become a medical professional, it meaning you're willing to assist everybody. It has nothing to do, no color, no gender.
No. We have a very large population of Arab villages in our area of it's called the Meshulash, from El-Fachem, from
the triangle.
And sometimes people very poor with the very crazy disease from the Palestinian area comes to me also, and we treat them. No one knows about this, but we do it. And I remember that we operated a lady from Gaza that had the cancer in the thyroid in our hospital. We do it because people needs to help people. We don't look on if he is from Hadera or is from El-Fachem. It's the same. And we have patients. We have chronic sinusitis patients from the Arab villages that have very large problems with allergy and nasal polyposis and allergy, and now we try to help them with the new biological injection that will dissolve the polyps. It's very expensive, and we try to make the Kupot Cholim, the HMO, to give them the drugs, and this is what we do.
And if I may say, for the listeners which are not really aware of what is happening in Israel, that you do it on a daily basis.
Every day,
because...
And Sabbaths also.
Meaning the hospital is working 7 days a week, and when a person is coming and you don't look at his gender, his religion, his nationality, you simply take care of him. That's it. This is you're living to the highest standard of humanity, in a sense, if I may say.
Yeah, and if you help them and also bring some innovation to treat everyone, Arabs, Jewish, Christians. Tzadal from Lebanon also come. And
really? People from Lebanon are coming?
They are living in Israel now, the Tzadal.
Okay. Yeah, the people that were assisting Israel when we had the Lebanon war. You work with them.
So we worked with them,
Yeah. I think we will have to have another conversation only about sleep apnea, sleeping in general, and sleeping apnea.
No problem.
Yeah, I'll be delighted because I think it's a huge subject, and I think it's becoming, a real worldwide problem. I think it's coming. It's like I wouldn't say that.
I just went to do research or literature search, and I saw that the undiagnosed sleep apnea in the United States is about 24 million people every year.
Wow!
So it's very huge number. So many people are not diagnosed, and they have sleep apnea.
Wow! So we will have another conversation about that. But I think you have other issues that you're dealing with besides sleep apnea and.
We can jump to this.
Yeah. I'll be delighted
because time is flying.
Yeah, I know. I saw.
So one of the projects I told you about the electronic nose with Professor Hayek, he got a large grants for the Technion for this, and another one is the pomegranates that I told you. There is another subject that maybe I can just tell you. It's the OPMD. OPMD is a disease that it's a genetic disease that patients suffer it from. There are many Bukhara, Jewish Bukhara patients.
Okay.
Patients from France.
Wow.
Patients from Quebec.
Wow.
Canada and New Mexico in the United States.
Wow.
They have this disease. The guy that I worked with and still working and he did many research on the genetics here is Professor Sergio Blumen. He's a neurology expert on this issue. And these patients suffer from a problem with they have dysphagia and ptosis. What is ptosis? Ptosis is when you eyelid, the eyelid, the upper eyelid is falling down.
Oh my God.
They look like this.
Oh my God. They can't open their eyes.
Yeah.
Oh my God.
And they need a blepharoplasty, like ניתוח חפפיים.
Yeah, they need to raise
their eyebrow.
Yeah.
And another issue, the main issue, is that they have dysphagia. They cannot swallow.
Oh my God.
And it's being deteriorated, and they being thin, and they cannot swallow very well. And slowly during the year, we treat them with the clinic, with the helping with all kinds of targilim and also exercise with audiologist and speech therapist. And finally, if it's not working, we need to operate them, and we do the operation. It's called cricopharyngeus myotomy. We cut the sphincter of the upper esophagus, so it will open and they can swallow better. And we are the center of this disease in Israel, and people from all Israel is coming to Hillel Yafe, to the neurologist and to our department, and we will do them this surgery. Many patients in Israel doesn't know even they have this disease, and they look in the internet, in the Google, and they see that we do it, and they see that they have this disease, and the family doctors doesn't know very well this disease, but slowly we have a big data of patients, and we help them. Another issue is that idea that I had.
Yeah.
There is recurrent tonsillitis. It's very common. Recurrent tonsillitis is tonsillitis that people have like 3, 4, 5 times a year, and what we do for them is surgery, tonsillectomy.
What is it?
Tonsillectomy is taking the tonsils out.
Oh, okay.
It's painful. It can bleed. They need anesthesia, and I saw that in the tonsils, and from research, there is a biofilm. Biofilm is a thing. If you will read on this, is that the microorganism are building like small houses to defend themselves.
Wow.
From polysaccharides.
Wow.
They are also in pipes of water in agriculture.
Wow.
It's called biofilm, and you have it in another places in the body with chronic
infections. Yeah.
And sometimes it's in the tonsils, and I had an idea to treat this thing without surgery, with radiofrequency. So we did a research, and we put on local anesthetic, like minimally invasive surgery with radiofrequency in the tonsils.
Wow.
And we had a very big study, and the results are very high. Now we are
very positive.
Put it in the literature, and it's very good. So this will save surgery.
Wow. Again, you used physics.
Technology.
Yeah, physics, and you translate physics principles into physics technology, and you put it into a medical context.
Context to help
patients. That's beautiful. I think I know you have a. So I think if we can schedule another session only about sleeping.
We will do it.
Okay, and was there anything else that I forgot to ask you about that you think is important? I'll be delighted to hear.
I think this is for 1 hour on the edge of the things. It's enough.
But if there anything else important that you want to share with the audience, anything you want to tell us about, Israel, health, the medical field in Israel as you see it, the contribution of what you do here in Israel, or you and your colleagues to the worldwide population, or to the medical field in general, or what are your dreams for your future, whatever you feel like.
Yeah, I think our hospital is getting service to very huge area.
Okay.
And the budget from the state is very
Small.
limited.
Yeah, limited, yeah.
Most of the donations and the contributions are going to the big ones in Tel Aviv, in Haifa, and we have the general of the head of the director of the hospital is also otolaryngology, ENT. ENT is very good and he's very smart. His name is Miki Dudkevich, and he understands that we need to bring people to help the hospital. And he brings some contributions and some people to raise the hospital, and we built a new pagia, nursery for the neonates.
Wow.
It's already built.
Wow.
Now we have a very big area, and we want to maybe build their building for clinics, build hotel maybe, and make investment in medicine, because I think this is the way, because medicine is taking a big issue in economy, and I think we can do this way. I'm going to let him know that maybe we will open, maybe, I don't know if you will agree.
Yeah, of course.
A center for innovation. If we will do a center for innovation in our hospital, it can connect to the Herzliya Bentchumi.
The IDC, yeah.
They want to do business with us, the Technion.
Wonderful.
And also the Emirates.
Yeah.
So it's a big issue.
So I'll be delighted to have him here and speak to the world, or whatever kind of collaboration. I'll be delighted. Yeah.
We need to think wide.
Yes. We need to be bold in our dreams, I think. Yeah. If you don't dream big, you will get nowhere.
If you don't think big, you don't go there anywhere.
I agree. Okay. It's been a great pleasure. Thank you so much for being with us.
Thank you for the conversation. It was actually the time fly, and it was excellent.
Thank you. It was my real pleasure, and thanks of all to Lior, who is being with us and assisting us, and to Aya, which connected us from the beginning.
Thank you for Aya.
Thank you, Aya. So until next time.
Until next time. Thank you.
Thank you.